I think our patients really want us to partner with their local physicians. They want to feel like they have one big team, and they really want to get as much of their care close to their own families and close to their home as possible. So we work very hard to communicate, partner with, and build relationships with local physicians as part of the brain metastasis program.
To our knowledge, UNC has the first multidisciplinary brain metastasis clinic in the country, and we find this to be very fulfilling for several reasons. One, it really facilitates communication between the core physicians. We're not having to track each other down in the OR or in our clinics or even not in clinics, so we can make real-time decisions.
And patients get a unified treatment recommendation. They leave with a plan, and they don't have to worry, well, I got to see the neurosurgeon next week, and I'll see my medical oncologist the week after. I saw the radiologist today.
We really want to make sure that every patient, regardless of how they enter our system, finds their way to the best treatment for them. So I think one of the things that makes Tim and Carrie and our whole team such a wonderful group to work with is that the patient is really at the center of what we do. So we bring the right treatment to the right patient at the right time.
We try to use every resource at hand, and thankfully Chapel Hill has a lot to offer.
After we develop a treatment plan, one of the first things that I do after stepping out of the patient's clinic room is call the referring doctor. And that is not only reassuring to the referring physician because they know what we're thinking, but also very reassuring to the patient.
We like to get out there and we like to meet with the referring docs and stress that we're here to improve the treatment of cancer.
We really want them to join our team for the care of that patient, and they'll have certain resources that are available locally to treat the patient. We may have a few unique resources or expertise that are available here in Chapel Hill, and together that partnership really brings about the best care for the patient.
So I think one of the unique aspects of the program is access to clinical trials, and I think while we've made strides in the care of patients with breast cancer brain metastasis, we're still trying to understand the best approach.
During my training, I had a faculty member that I worked with who had a pin on his white coat that I always thought was pretty cool. It said, "Research cures cancer." So I think that it's essential we try to put as many patients on clinical trials as possible. Not just to make the treatment better, but also to make the side effects of the treatments less. It is our goal, and I think fundamentally our obligation as academic physicians, to run clinical trials.
So as a fellow, the majority of clinical trials at that time excluded patients who had brain metastasis across the board. And I think we're really starting to see a shift in the tide. Now we're actually seeing clinical trials in development and completed that are specifically devoted to patients with brain metastasis.
The goal for a particular patient of a clinical trial is to find a successful treatment for that patient. But along the way, by summing up the data from multiple patients, we hope to really learn whether a particular new treatment is of value.
So I think with the advent of new therapies, new surgical techniques, new radiation therapy techniques, we'll be able to hopefully improve patient survival in a very meaningful way.
So one of the nice things about multidisciplinary care is that all of your physicians are in the same loop.
I see collaborative efforts like the one we built here in Chapel Hill as the best way forward, and I think the combination of top-notch clinical care and novel treatments offered through clinical trials give our patients the best chance of success now and give us the best chance of advancing our care in the future.